With us are Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Sarah Ho, Chief Manager, Patient Safety and Risk Management of the Hospital Authority. Dr. Chuang would first brief us on the cases. As of last night, there were 11 newly confirmed cases, case number 11331 to 11341, consisting of 7 females and 4 males aged 3 to 57. 3 were imported cases. 2 arrived in Hong Kong from the Philippines. 1 arrived at Hong Kong from Bulgaria. All 3 cases provided samples on the 12th day. There were 8 local cases, of which 2 were untraceable. 6 cases were linked to previous cases. Of the 6 linked cases, 5 were linked to Ursus Fitness Center. 4 of the cases were close contacts of customers. 1 of them was a customer of the fitness center. 5 were confirmed at quarantine centers. For the Ursus cluster, the total number of cases is 132, including 7 members of staff, 87 customers, and 38 close contacts. There was 1 case linked to a previous case. The patient lived in Dynasty Court. The patient was a 3-year-old child. She was in preschool. The school is located at On Fung Building, called Woodland and Montessori Preschool, which is located on Kane Road. Together with her 2 family members, she was asymptomatic. Her family member was an untraceable case, so we could not ascertain who infected whom. And as such, the patient was considered untraceable. The sample tested on March the 15th tested positive, and she last went to school on March the 12th. But since her case and the case of her family member were both untraceable, for those working at the preschool, they would have to be sent to quarantine, and as such, and all the staff members and students of the preschool had to undergo compulsory testing. For the 2 untraceable cases, one of them worked at Ting Wong Building, Shop A. The patient worked at a bar called Mr. Brown as a bartender on Ship Street. Some 10 staff members were sent to quarantine, and the patient experienced discomfort on March the 15th, and he last reported to work on March the 14th. And the patient lived in Block B, Phase 3 of Kwan Yik Building. Since this was an untraceable case, in the last 7 days, the patient lived in a hotel in Sheungwan, and as such, both venues had to undergo compulsory testing. Another untraceable case, the patient was a housewife living in Block A of King Lam Mansion. She lived with her family, and she experienced discomfort starting from March the 9th. And This is an untraceable case, so we would trace the whereabouts in the past 7 days. She went hiking in Taiyo with her friends and family, and they also dined together. Her family members visited her, and she brought her family members to see the doctor or hospitals as well. For the other linked cases, apart from the fact that the preschool I mentioned had to undergo compulsory testing, other buildings also have to undergo compulsory testing, including Chongjuk Yun House 1 in Stanley, Hoi Kong Building on Gloucester Road in Causeway Bay, Ablay Chow Yuan Yun Road, Pick On Court, Devo Road West 28, a hotel in Shanwan District. The patients stayed at these places, and as such, they have to undergo compulsory testing. For our surveillance work on the N501Y strain, there were cases in the last few days detected with this variant. There were 4 imported cases, 11317, 11330, etc., and 11313 altogether. There were 91 notable cases with this variant, and 37 involved the UK variant, 8 involved the South African variant, and 5 were similar to the Brazilian strain, and another 47 cases were unclassified. In recent days, because the URSIS cluster involved a lot of adults and children, many members of the public had questions about our arrangements on close contacts. The government issued a press release yesterday to explain the isolation and quarantine arrangements. So for details, please refer to the release. Basically, we would consider the interests of the children and their family members in our quarantine and isolation exercise. We would assess whether the patient is the child or his or her family members. Normally, patients and for patients, they would be sent to hospital. Close contacts would be sent to quarantine centers. That is our principle. But in some cases, certain individuals might require care. For instance, a kid might need to be taken care of by the mother, or that the child must be taken care of by their family members. In those cases, we would have special arrangements. If the close contact is not a patient, if they were sent to quarantine or hospital together with the close contacts, there could be risks. So if they are kept together, the individuals could be infected. And we have other special arrangements as well. For instance, for persons with special needs like pregnant women or those with medical needs, at quarantine centers, we have 24-hour medical teams available. For details, please refer to the press release.
Now, for preliminary confirmed cases, about 10. Several are untraceable for now. The first case is at Kwai Chung. The person works there. On the 6th of March, the person began to feel that he couldn't smell properly, and 16th of March started to breathe not smoothly, And then around about 8th of March, he saw a doctor. He mentioned the problem. The doctor suggested that he or she undertake a test, but no test was taken because the person felt it wasn't that serious. And then he started feeling he couldn't breathe smoothly, and then he lives at Potek Mansion in Kwai Chung. He works in Kwai Chung. Some of those who work with him, maybe we have to follow up with them. And he felt unwell earlier, so he or she had meals with others since then, so we had to follow up. The second case is a 15-year-old boy. He he goes to study at Chu Sing Secondary School in Mount Kor. 12th of March, he didn't feel so well, and that's the last day he worked, and he lives at Tai Nam Street in Prince Edward. We couldn't find a source, and we have to follow up with his family members and fellow students. If the case is confirmed, the secondary school has to undergo mandatory testing, and the school has to close for 14 days. The third case is a 36-year-old person who works at One Island East in Quarry Bay, and he or she does IT work. She lives at Lowhurst Park, and on the 17th of March, a test was taken, and 7th of March, and it was positive. No particular high-risk connections, but went to gym at Dorset House twice a week. So it's untraceable at the moment, and the case will be traced for 7 days. The last time went to a gym was 10th, and those who trained with him had to be tested. The gym has to close for cleaning, and some staff have to be tested. Another one, maybe a case of a person who recovered earlier. It wasn't a unconfirmed case, and on the 6th of March, the person was sent to hospital, and several tests were still not confirmed, and 16th of March, still unconfirmed, but there was and then recently there was another test, and the virus was again found, so we may give that person a confirmation number, a 36-year-old male, an engineer. He works at Cheung Long Industrial Building in Lai Chi Kok. On the 4th of March, started throat ache, and then he lives at Block F of Lok Yang San Chun in Chun Wan. He goes to inspect some sites, construction sites, sometimes to a site in King Lam Street, Lai Chi Kok. Sometimes earlier on, he went to site in Yuen Long. Now he might not have infect others right now, but we will follow up on previous close contacts. We will see whether this case would be confirmed. So those are my reports today. Dr. Ho, as of 9 a.m. this morning, the past 24 hours, the hospital authority system had 22 cases reported, 23 patients recovered and were discharged. We have 10,808 patients who recovered. As of 9 a.m., 287 patients are still at the 24 public hospitals and the North Lantau control center, and 10 cases of serious, 267 steady. The number of negative pressure beds, 64% usage. And the usage rate for the negative pressure wards, 14%. Those who wish to ask questions, please tell us your organization first. TVB. Now, you said there were 4 cases of variants. Now, 41 not yet classified. Now, is there a risk where these variants might infect the community? And today we see that there was a nurse who was vaccinated, and there was adverse reaction. Any other adverse reaction cases? Now, the variants found so far, classified or not, all of them were imported. Now, they were found at the airport or at the quarantine center or at the hotel when they were tested. Now, for all these travelers to Hong Kong, they had to be quarantined for 21 days. So for now, the cases were found at those places. At the public testing laboratories, they test all cases. They analyze all confirmed cases, including local cases. So if there are local variants, we would be able to detect them. The speaker is not using the mic. Now, last week, a colleague was vaccinated and felt unwell and went to see the doctor. But as you know, overall, if a patient comes to see the doctor and if it's related to vaccination, according to the reporting mechanism, we will report to the health department, and then they will let the experts follow up and study the matter. Now TV. Now, the case just now, you mentioned a 3-year-old child. Is she a family member of U.S. General Consulate staff? Now she received a Sinovac vaccine. How were they affected? Was it at the school? And the inspector, would there be mandatory testing? And the Eastern District nurse, when was she vaccinated? What's her condition? Did she suffer from chronic illnesses? Now, for the 3-year-old child, she lives at Old Peak Road, Central and Western, Dynasty Court, Block 3. The 4 family members, confirmed cases, that was a case yesterday. For that family, one day they went to the family of the home of another confirmed case, so they were close contact with that confirmed case, and that confirmed case attend school at Kowloon Tong government primary school. The 2 children go to the same school and they were friends, so as close contact when we traced them, they had been tested. And now as for the father's employment, now for those 10 odd persons who worked with him were sent to the quarantine center. So no other person needs to be mandatorily tested. Now, for the Eastern Hospital, a member of staff on the 3rd of March, starting that day, suffered from headaches, diarrhea, not uncomfortable, feel uncomfortable, and low fever. Yesterday, she was admitted to hospital. For the moment, her situation is stable. On the 23rd of February, she was vaccinated.
Yesterday, the hospital followed the mechanism in reporting the incident to the Department of Health. The hospital will closely monitor the clinical conditions of this staff member, including conducting checks and tests, and to find out about the cause of her discomfort and to draw up the treatment plan. Did you ask about a patient who received a vaccine? An earlier tested positive, and the patient received a dose of vaccine on March the 24th. Let's take a question in English.
Thank you. Several English questions from RTHK English News. First, looking at the new cases, do authorities believe that the outbreak linked to Ursus Fitness has been kind of brought under control since there is a significant drop in the number of cases linked to that cluster? Second question related to the police officer who actually received a jab, a Sinovac jab, and he's still infected. Can authorities confirm if whether this is the first case of a person who is getting infected even though he has been vaccinated? And is it normal for people to get infected even after a jab, well, the first jab, or is it something to do with the efficacy of the vaccine? And third question, third question to HA about serious incidents after people take the BioNTech jab. Can you guys provide the details of a case that relates to a patient who has developed a stroke after getting the BioNTech jab? Thank you.
We do observe and decline in number of cases related to the Ursus fitness gym, and all the new cases confirmed today are coming from the quarantine camp. So hopefully we have brought this outbreak under control, but we are still not sure if those close contacts or cases before they have been admitted to the hospital or quarantine camp had other infection in the community. So we have to still be vigilant and monitor the situation and observe whether there's other cases related or unrelated in the community. And the man who had received the Sinovac vaccine on 12th of March, and they had a gathering with a confirmed case on 7th of March. So we believe that they have already been infected when tested on 14th, only 2 days after the vaccine, the first dose. So we do not classify this as an ineffective vaccine also, because usually you take 2 doses for the vaccine schedule to be completed, and usually it takes some more time, at least maybe 2 weeks or so after completion of the vaccines, before you can count whether this is ineffective or not. But as we all understand, all the available vaccines, they are not 100% effective, and we are not sure whether they can prevent all the infections. But of course, for severe infection and mortality, we do believe they have quite high efficacy. So it is expected as more and more people getting the vaccines, and if we still have transmission in the community, we may still have people who completed the vaccine and get infected.
For patients presented to HA with adverse event after immunization, we will, according to the mechanism, report the case to DH. And then we understand the experts will analyze the case and report it to the public later on.
下一題，英文問題講。
Next question in English, please.
South China Morning Post. First question is also about the 38-year-old police inspector. So can authorities confirm that this is the first infection that was confirmed after vaccination? Second question is, some people have questioned that the quarantine arrangements for children. So should breastfeeding moms who are infected be allowed to stay with their kids, even if their kids are not infected? Because some medical experts are saying that this should be allowed because COVID-19's risk on babies are mild. So will there be further discussion about this rule? Third is there have been reports of a new COVID-19 variant linked to the Philippines. And we've seen quite a number of imported cases from the Philippines. And even Cathay Pacific flight from Manila was banned for 14 days. So will there be additional travel restrictions considered from the Philippines? Thank you.
I have to reiterate that this is not an infection after vaccine. The patient had the vaccination 2 days before he was tested positive. So this is not related to the effectiveness or efficacy of the vaccine because it takes time for the vaccine for the people who receive vaccines to develop immunity, and also you need 2 doses for the vaccine to be completed. And I understand for whether isolation of the case with the breastfeeding mothers or babies is only by case situation. We'll consider individual case by case because different families have different concerns and also considerations, whether there are other people who take care of the infants, whether she wants to continue the breastfeeding, and whether they understand the risk of transmission. So for the VOC, we do occur quite a number of VOCs from the Philippines, but as well as from other places, such as Pakistan, and other places. But currently we have import, all the travelers to Hong Kong, they have to subject to 21 days quarantine designated hotel. So we believe that actually VOC may occur in various places of the world, and it really depends on whether those places who do the testing for VOC or not. So we have to safeguard to play safe to quarantine all travelers for 21 days. This hopefully can help to prevent any VOC from spreading to the community.
下一題，前邊。
Next question, please. I'm from Hong Kong 01. For the 38-year-old male inspector who tested positive after receiving vaccination, what is his current condition and what is his CT value? Did you investigate what the origin was, or was he infected by his children? He lived in Block C of Police Inspectorate Quarters in Ho Man Tin. Were there any new cases upon compulsory testing, and is there any transmission risk? And would environmental samples be taken, or would there be any lockdown operation? And was he the only person who was vaccinated? A doctor pointed out earlier that if a person who is vaccinated is confirmed, the CHP might adjust the policy on quarantine or isolation. So I'd like to know whether there's any update. As for the healthcare worker in Eastern Hospital who felt discomfort upon vaccination, she complained of joint pain. What extent was her pain? What kind of checks would be conducted by the hospital to ascertain whether such reactions were related to the vaccine? For the cases today, I'd like to clarify some of them. In one of the compulsory testing lists, Dr. Chuang talked about a hotel in Central and Shangwan. Were you referring to Ibis Hotel? Yes. for the 3-year-old male kid who lived on Kane Road or went to school on Kane Road, how many staff members had to be quarantined? And did the staff work at other schools? For Dr. Bond in Wan Chai, was the ventilation poor? Could there be any likelihood of an outbreak like Mr. Ming's Chinese dining? For the joint dynamic, how many people were quarantined? Did any of the individuals tested preliminary positive? For the HSBC main building, are there any new positive and preliminary positive cases, and would environmental samples be taken, and could the canteen be the origin of infection?
You're talking about 11325. That's the police officer. He and his 3 family members were related to a case. They went to the home of a confirmed case. All 4 went there. So their source was that confirmed case. All of them were asymptomatic. The building where he lives, Homantin Hill, Inspector Quarters, Block C, yesterday, it was subjected to mandatory testing. And then the 3-year-old child, we are following up on where she went to school, how many people had to be quarantined. So we don't have information at the moment. Now, if the teachers went to other schools, now we don't have the information. Even if they went to other schools, they are not confirmed cases. They are at most close contacts. Now, we are gathering information on the class situation, how closely did they wear masks, and so on. Now, on the bartender at Dr. Brown, now they had the people there had to be mandatorily tested. Now, the other case, it's not related, so we will ask the gym to be thoroughly clean and for them to be tested once more. Now, for the HSBC main building, there was mandatory testing and no new cases so far. Eastern Hospital case, now we already reported to HD, so it's not suitable for us to discuss the situation, the clinical situation of individual patients. Now, after our reporting, the experts would analyze the case and then report would be made to the public. Next question. Economic Daily. Now, the inspector who was vaccinated, now he was subjected to Sinovac vaccination. Is that the first case of infection after vaccination? How is his CT value? Maybe after vaccination, the volume of the level of virus would be lower. And also the Suma restaurant, there were 9 patrons who were vaccinated. Now, CHP only announced yesterday evening what's the reason. And the 9 patrons, did they know each other? Or they did not know each other, but they were infected? Let me reiterate, that case was not a case of confirmed infection after vaccination. The vaccination was 2 days before. Previously, there was a family meeting on the 7th of March. On the 14th of March, we traced the case. They were tested and tested positive. And he was vaccinated on the 12th. So this has nothing to do with the effectiveness of the vaccine. Now, on the situation at Soma, now, all the cases had to do with nurses. They were either customers or those who work there or close contacts. So it seems that this is a place where many people went. and they didn't go there during infection period, but during incubation period. Some felt unwell on 11th, they went there in late February or 2nd of March. So it seems that the source is at the gym. But 4 of them on the 5th of March, on the same day, they had drinks and food together. And then others went there on different days. So we don't think there is a major eruption or transmission. It just so happens that they went to this restaurant. But it seems that sometimes there's a significant number of cases. Some people who are asymptomatic, they went there during the period of transmission, and they might have infected other patrons or staff. So we told the restaurant to suspend business for the time being for cleaning. Isn't that the restaurant has confirmed transmission? But it's felt that a relatively large number of people went to that restaurant. There was another 2 restaurants where some people went, Trivala, and the one called Treehouse. 2 or 3 or 4 of the cases did go there. They didn't go there on the same day. But it seems that these are popular places, that many people went there. So they went there during incubation period. So to be on the safe side, we asked the restaurants to be subjected to major cleaning, and the workers would be tested before they go back to work. AM730. Now, for the untraceable 2 cases today, is the case number. The bartender, did he come into contact with customers during work? The hotel in Shanghai that he went, did he go there because he had symptoms or for other reasons? Now, the police officer wasn't confirmed after vaccination. Are there other cases where someone received the first vaccine and then was confirmed? Now, in the future, does the male police officer has to be vaccinated for the second time? Would it be the second vaccine? And apart from Suma, some people went to restaurants during incubation period. So for that building, you can't say that the people went there during period of transmission, because there was no particular notification that the restaurants were in period of transmission. So the standards have to be amended. The 2 cases without untraceable, 11334 and 11338. Now, untraceable for now. Now, usually after vaccination, we would only then have a record on whether it's immune. Now, it would usually be after the 2 vaccinations. So we wouldn't have the record information after the first vaccination. So we don't have any information of infection 14 days after the 2 vaccines were injected. Now, as for this case, not long after vaccination, it's a confirmed case. Now, whether it's due to vaccination, the experts will study that. Now, previously, we are informed that there is no conflict. Now, if you take note of the list of buildings, now, they went there during the period of transmission, or went there during that more than 2 cases, cases of confirmed cases going during incubation, then those would be noted. Now, to ask HA.
The nurse who experienced discomfort from Pamela Yu National Eastern Hospital, who experienced discomfort, how long did the symptoms persist? And after she was sent to hospital, what kind of treatment was given? Did she have any chronic illnesses? Did you assess whether the symptoms were related to the vaccine? You said there was another case last week in which a healthcare worker experienced discomfort upon vaccination. If so, can you disclose details of that case? What kind of vaccine was administered? What kind of discomfort was experienced, etc.? Altogether, how many healthcare workers experienced discomfort and needed to be hospitalized upon vaccination? Would this affect the operation of the HA? And now a question for Dr. Chuang. For case 11325, the police officer, did he receive the Sinovac vaccine after admitted to hospital? Was any antibody tests given, and what was his CT value? What did the officer experience any symptoms so far? As for the restaurant Zuma at the Landmark Central, is it that all cases involved customers? Were any patients, staff members? If they were customers, when did they visit the restaurant? Did they sit at the same table or at nearby tables? Would you recommend customers who visited that restaurant within a specific period to be tested? And are you going to trace those other customers? Thank you. Earlier, a healthcare worker at Yanchai Hospital was vaccinated on March the 8th in the afternoon. That worker experienced discomfort. She was sent to hospital and she was discharged 2 days later. Altogether, there were 2 healthcare workers who experienced discomfort upon vaccination, and they are both in stable condition. As for the nurse from PYNUH, we are providing treatment and there are no updates so far. For case 11325, his vaccination was unrelated to the positive test result, the CT value would be irrelevant. For Suma, the cases visited on 26th and 27th of March, the 2nd of March, the 5th of March, some of them were at the same table. There were cases who visited on March the 9th. 2 individuals visited on March the 2nd, albeit at different times or hours. They visited during the incubation period, but since there were a number of them, we would play safe by asking the restaurant to be disinfected and for the individuals to be tested. All the cases were customers. So far, no staff members were infected, but nonetheless, we asked them to be tested. Some of the confirmed cases use the Leave Home Safe app. They would receive notifications if they use the app. Those who receive notification should be tested. We experience the premises to be closed until all the staff members tested negative from the RTHK. For the 38-year-old police inspector, what is the Department of Health's assessment of the officer? Was there a likelihood of infection before the vaccination? Why would he test positive despite the vaccination? Does it mean that a person would only be immune after 2 doses of the vaccine? Normally, how long would it take for antibodies to develop upon vaccination? For the nurse at Eastern Hospital, did she have hypertension as reported? And would this condition be related to her symptoms? would you suspend the administration of Sinovac vaccines for healthcare workers? Dr. Chuang, the number of confirmed cases has gone down. Is there a or can we only relax the social distancing measures when more people are vaccinated, as suggested by the Secretary? The individual attended a gathering on March the 7th, and on the 14th of March, when he had no symptoms, the test result came back positive. So it could be possible that he would be infected when he was vaccinated. Normally, such cases would not be classified, and there are 2 doses to the vaccine, and there must be a window between 2 doses. And we would need to consider the time needed for effective protection. But having said that, the protection would not be 100%. So far there were no cases of infection among people who received both doses, and with a higher take-up rate, inevitably we could see such cases, since we know that the vaccines could not provide 100% protection. From a public health perspective, any relaxation of measures could lead to a rebound. We reported the incident to the Department of Health. The experts would assess the situation, such as the connection with the timing of vaccination, the symptoms present, relevant data, etc., before ascertaining whether there's a causal relationship with the vaccination, and the results would be announced later. The experts would carry out a causal assessment. Any other questions? Final question. I'm from Apple Daily. For the cases today, for case number 11331, was it the family member of the staff at the U.S. Consulate General who tested positive earlier? As for the nurse at Eastern Hospital, Dr. Ho said she had symptoms such as low fever, but according to reports, she developed symptoms, and at one point she was almost unable to walk. Is there information showing the number of people who experience similar side effects upon receiving the Sinovac jab, and by what for Sinovac there is no data on the extent of protection upon receiving the first dose of the vaccine? Is there such data available? Thank you. Yes, the case is 11331.
而家
Right now, this colleague at the hospital, her situation is stable. As for her clinical situation, we are still conducting examination, and we will come up with appropriate treatment. End of this press briefing. Thank you. In theory, after vaccination, the onset, the seriousness or the mortality of the onset would be reduced. This case has nothing to do with vaccination, however. End of press briefing. Thank you.